Well, Sophia and I are actually going to do this a bit together. I'm just going to do a quick overview of foundations and kind of how they fit. And then the foundation we're going to really talk about is the Healthcare Foundation sponsoring this program. And that'll be a good example of foundations in California. I think the first thing to know about California is that we have a lot of foundation philanthropy in California as a state, and it makes us a really rich landscape. The way that that fits for clinics, however, is important to understand. Clinics are heavily publicly funded, whether you're talking grants or reimbursement. Certainly the reimbursement is mostly public financing. Melissa's going to talk about that. But even on grants, their grants tend to come, big grants tend to come through the federal government. And some of you, I know Teresa's even going to be working on one of those grants in her fellowship. But those are large grants. They're kind of the bread and butter of clinics, whether it's a project or reimbursement for uninsured. So the reason to talk about the foundations a little bit is because they are an odd duck. Every foundation is a little different, and clinics probably have a foundation grant or two, but it's not a regular source of financing for them. It's probably not a large source of financing, but it is a flexible source. And so they have grown to love the foundations. Okay, and so which button advances?
I can also use it as a...
Oh, a mouse.
It's a mouse. Yeah, there you go. Hit next.
Great.
Was it working for you?
No, it didn't.
Here. Hit escape, so we get that off.
Yeah. Hit escape to get the
little screen off.
Yeah.
Now hit.
Okay. Great. So these are some of the larger foundations in the state, and we call them conversion foundations. And because you'll hear that term, I thought it was worth defining for you. There have been a lot of organizations in California that have moved from being a nonprofit organization to be a for-profit organization. Some of those have been health insurance companies. Some of them have been hospitals, all kinds of nursing homes, all kinds of health care related organizations. These foundations that you see here pretty much were all health plans, health insurers that converted from nonprofit to for-profit. When you're a nonprofit, you can't take your assets with you. You are a public benefit, and so when you want to change and become a for-profit, there's a huge negotiation that decides what will happen to sort of the assets of the nonprofit. And that's one of the reasons we have such a great landscape in California. These are, as I said, some of the larger ones. Sierra Health Foundation was really the first big conversion. This started in the 80s, but there have been hundreds now of different conversions across the country, certainly. These are California foundations. And I won't go into any detail about the Healthcare Foundation, but I thought we would just talk for a few minutes about some of the others that are up on the screen because they give you a good flavor for what the foundations are doing specific to community clinics and for the world that community clinics tend to circle in. Most of these foundations have an initiative or a focus area that is specific to low-income, uninsured, and the providers that take care of them. The California Endowment, which is one of the largest conversion foundations here in California, spent 10 years and $125 million specifically on community clinics, on their information technology, on their basic capacities, on their business and management, and now has moved on to some other things. But that's an example of the kind of money that's flowing out of the foundations toward the safety net as a sector. Any one grant was probably not that large, and you won't hear in the hallways of a clinic, you won't hear the foundations, on the top of anyone's mind. On the other hand, those are the kinds of flexible foundations. Electronic health records are being implemented in clinics partially because the foundations created a readiness there for that to happen. The Wellness Foundation has done a lot of work around immigrant populations, and they very much live at the prevention side, the wellness side of the continuum, and they're initiative driven. So all of their grant making is, we're working on violence, we're working on the healthcare workforce, we're working on something that's got a defined boundary around it, here are our goals, do you want to apply to us for this bounded program? And those programs last a number of years, and then they tend to end. The California Endowment, by contrast, does their work very deeply in 14 places and then has a lot of state policy work that they do across the state and a lot of it in state government. Sierra Health Foundation, similarly, is a regional foundation. They serve from here to the Oregon border, and they are launching a safety net initiative for the clinics in the Sacramento area. And then I put the Health Trust up there because it's an example of some of the smaller, more regionally focused foundations. But even the foundations like the San Francisco Foundation, Community Foundation, East Bay Community Foundation, a lot of those have a healthcare. Can you advance to the next slide, thanks? Have a healthcare focus, and we have other foundations than Conversion Foundations who also are pretty solely focused on health. The Blue Shield of California Foundation is a corporate foundation funded solely by the health plan, which is a nonprofit health plan, but it every year funds quite a good amount of money that flows out of that foundation, and they also focus on community clinics. So as you're hearing, if you add all this up, the community clinics have a lot of places inside foundations to go, but they have learned over the years sort of the interests of each foundation, the niche that each foundation is living in. They probably have a program officer or two who they have, on their cell phone that they can speed dial and talk to, and they really stay involved with the foundations. And I think that's one of the reasons when I turned this to Sophia that this program makes so much sense. You were kind of, I could tell, puzzling, like, what's a foundation doing here if the clinics don't have an ongoing formal relationship with that foundation? In a sense, they do. They're in relationship with the foundations pretty dramatically. Kaiser, although not formally a foundation, its community benefit spends a lot of money and a lot of it on community clinics. And these foundations all talk to each other and try to make sure that they are complementing each other and not, leaving too big a gap, but also not sitting on top of each other in exactly the same space. And then, as I said, the community foundations, Silicon Valley, San Francisco, East Bay, San Diego certainly has one. There's a community foundation, at least one, in pretty much every area, and they all have a health piece that they focus on as well. So it's a complicated world. It's not a big dollar to any one clinic, but over time and focused on clinics, it does end up being a big dollar. And then lastly, I thought it was useful to talk about the foundations really in some of their other roles, and Sophia will hopefully talk about this with Healthcare Foundation because they're one of the leaders, I think, in their non-grant resources. We all think of foundations for grants, that's certainly correct. But in addition to that, Healthcare Foundation runs California Healthline, which is a news aggregation. I love it. I've got my healthcare headlines if I've looked at my Healthline for the day. The CCI Voice, which is something that you can all sign up for, was started with endowment money through Tides Foundation. The journal Health Affairs is largely funded through philanthropy. Sometimes a foundation will buy an entire journal of Health Affairs for a certain focus area. They write articles. They tend to fund the academic articles that are in Health Affairs, and so it's while it's not about philanthropy, it's about healthcare, it is largely philanthropy-driven. And then lastly, Grantmakers in Health, GIH, is a healthcare association that also follows the trends in healthcare and in philanthropy in healthcare, and much of what they have on their website is publicly available. There are things that you have to be a member to get, but if you wanted to see what's going on in health reform, certainly there will be things on their website. And I think also the entire span of health and healthcare, GIH has been really good about expanding into the health side. So, mental health issues and violence and even juvenile justice topics will be to some degree covered by Grantmakers in Health. Okay, so I'm going to leave it there with questions, from the group.